Till our last video, we have explored different aspects of cancer disease. Now, the question is, how can we stop this disease? That is exactly what we are going to understand today in this video. Welcome to SK Biology. Cancer treatment is not a single method. Depending on the type, stage, and location of cancer, doctors may use surgery, radiation, drugs that is chemotherapy, or immunotherapy for treatment. Let us start with the simplest approach, surgery. Surgery means the physical removal of tumor or cancerous tissue. As shown in this image, if there is tumor that is localized in one particular region, it can be safely removed. The surgeon may physically remove it by following these steps. Incision, that is making cut at the site where tumor is present. Then removal of tumor safely from that site. Then extra tissues are removed if needed, and then closure of that cut site. There are three different types of surgery. Lumpectomy, where removal of tumor from that site. Second is mastectomy, in which removal of entire breast is done. And third one is tumor resection, where removal of tumor from organ is carried out. Neat point. This surgery is the best treatment for localized solid tumors. It helps in curing cancer by avoiding spread to other parts of body. Surgery is often combined with radiotherapy. Now let us move to the second treatment, that is radiotherapy. Radiotherapy uses high energy radiation to destroy cancer cells. As shown in figure, radiation beam targets the tumor and damaged DNA of cancer cell so that stopping them from growing and dividing. Radiation therapy works as follows. When radiation beams are targeted on tumor cell, the DNA damage occurs in cancer cell. Because of DNA damage, those cancer cells cannot divide. Most commonly, X-rays, gamma rays, and other ionizing radiations are used in radiotherapy. Radiotherapy can be used before surgery to shrink the tumor or after surgery to kill remaining cancer cells. It can be also used for cancers that cannot be removed by surgery to control or destroy the tumor. Now comes a very important treatment for NEAT, chemotherapy. Chemotherapy involves the use of anti-cancer drugs. These drugs particularly target rapidly dividing cells. As cancer cells are characterized by rapidly division of cell, therefore many chemotherapy drugs are designed to interfere with process required for cell growth and division. Let us understand how chemotherapy works. As shown in figure, chemotherapy drugs are given into vein, that is intravenous, or by orally with the help of tablets. These drugs enters the bloodstream and reaches to the cancer cell, where it interferes with the growth and division of cancer cell and cancer cells are destroyed. These are some chemotherapeutic drugs like alkylating agents, anti-tumor antibiotics, plant alkaloids, and other agents like cisplatin. These drugs can be used for many types of cancer like leukemia, lymphoma, breast cancer, lung cancer, etc. Neat point. Chemotherapy is a systematic treatment in which the drugs can circulate through the body. It is useful when cancer has spread in the body. Now let us look at comparatively modern approach, that is immunotherapy. Immunotherapy works by stimulating the patient's immune system so that it can destroy by recognizing cancer cells. As that of chemotherapy, immunotherapy drugs are given by intravenous infusion. In this therapy, activated immune cells recognize cancer cells and then they attack and kill that cancer cells. Many times, combination therapy has been used for cancer treatment. where more than one treatment method are used for treatment of cancer. For example, combination of surgery, radiotherapy and chemotherapy, or combination of chemotherapy, then radiotherapy and immunotherapy. The exact combination depends on the type and stage of cancer. This table represents all 4 cancer treatments. For quick revision,